Employee well-being has been a topic in the law enforcement arena for several years now. A few months ago, one of our volunteers came to me to discuss having a peer support program here at the police department and in Eastern Wake County. It's much needed and long overdue. Employee well-being needs to be looked at in a holistic view. We need to consider not just peer support, but physical well-being, mental well-being as it relates to having trained professionals who are accessible from our staff. I love the idea of our employees having a variety of resources to turn to when they're not okay. My number one goal would be to create an environment where everybody knows that it's okay not to be okay. Our police officers deal with a lot of critical incidents throughout their career. In fact, most people will experience 2 critical incidents in their lives, and police officers will respond to nearly 200. When we're having continuous exposures to those kinds of events, it's important that we're taking care of our people.
In my professional career as well as my volunteer work, I have had the opportunity to work with law enforcement officers and have several law enforcement officers that have become friends of mine. And just over the years, knowing what they're exposed to, knowing what they see, knowing what they deal with on a day-to-day basis, I realized that there needs to be mental and emotional help for those officers to be able to, deal with the things that they see. The things that they see is not normal. And so we need to, make sure that we have the opportunity to help them with anything that they're having trouble with, having trouble sleeping, can't forget about something that they've seen. We need to have an avenue for them to be able to deal with those things, to be able to talk to somebody if they need to. Here at the Zebulon Police Department, they have a gym for their physical health. And it just makes sense to have something like the peer support team to be able to help with their mental health as well. And we need to make that normal. We need to change the paradigm and make that a normal thing to be able to talk about things. I had the opportunity and the honor to attend one of NC LEAP's seminars that they did, and realized that there was a need all across North Carolina, but certainly a need for the agencies that I volunteer with to have an on-site peer support team. And so I came back and pitched the idea to have an on-site peer support team with Chief Boykin, and she immediately was on board with it and thought it's been needed for a while. And so we've just been gathering information to start that program. So I'm really excited about that. I think having someone in different agencies it allows the officers to talk to somebody that is on their level, an officer talking to an officer, or a sergeant talking to a sergeant, and it's not necessarily in the same department. It may be, you want to keep things, you don't want to talk to somebody in your agency maybe about some things that you're dealing with, that you're going through there. And so it allows officers to talk to other officers in other agencies who are not involved, that may be able to offer them help and support. Most of them have gone through NC LEAP's, one of their seminars, and then they are also CISM certified.
So the number one goal is knowing that it's okay not to be okay. And number 2 is to have a variety of resources for our employees so that they can manage their stresses in whatever way works best for them.